Money with David Blain, a discussion about your money, including everything from investing and taxes to real estate. Now with this week's program from D.L. Blain and Company in New Bern, here's David Blain.
Hello and welcome to All Things Money. I'm David Blain, your host for the next 30 minutes, where we'll have an entertaining and thought-provoking discussion on your finances. We'll discuss everything from investing and taxes to real estate and everything in between. If you have any questions or comments on the show, as always at the beginning, we give out our phone number, which is 252-633-0107. Our email is allthingsmoney@dlblain.com. That's allthingsmoney@dlblain.com. And feel free to visit us on the web at www.dlblain.com. There you'll find information on myself and my firm, as well as archived copies of the show. If you missed the show from previous weeks, feel free to log on there to the website and download and listen. There's some great information on there. Well, we've got another excellent show in store for you today. We're going to start off talking a little bit about insurance. Namely health insurance. We've done a lot on the show the past several weeks, several months on the health care reform and some other things that are going on in the marketplace. And one of the things that we talked about in the some of the things that are not being renewed, I mentioned there was what's called the medicine cabinet tax. And it was something that Obama was canceling or implementing what we call the medicine cabinet tax. By that, I had mentioned that things like HSAs, HRAs, FSAs, these are different types of health plans allowed for an individual to purchase over-the-counter medicine such as aspirin, Tylenol for your kid. They got a headache or something. It allowed you to purchase these with tax-free medical dollars. And so this generated a lot of questions about what are all these health plans and what are some alternatives out there today. And so I wanted to spend a few minutes discussing them. The first one I want to talk about is what I call a Section 105 plan. It's an HRA, a Health Reimbursement Arrangement. It's allowed, permissible under Section 105 of the IRS tax code. This is a plan that the story goes that when this was enacted, it was enacted at a time when there was a lot of other things going on, and it didn't really get a lot of press at the time, and so it's kind of languished in the tax code, and not a lot of people understand it or have heard about it. I personally think it's one of the greatest things out there. This is mostly going to be for, your self-employed people, small business owners and the like. This is actually the plan that we use at my company. It's called a Health Reimbursement Arrangement. And what it allows the employer to do is the employer is allowed to reimburse employees for qualified medical expenses on a tax-free basis. So, for example, if you have an employee that their spouse doesn't work anywhere else and they need health insurance, well, they go out and they purchase the health insurance plan and they submit that bill to the employer for reimbursement. The benefit to the employer is that you set a monthly limit on the expenses. So, for example, at my firm, we have a $1,000 a month limit. So each employee can submit for reimbursement up to $1,000 per month of qualified medical expenses. From the employer's perspective, it's a great benefit because when you give a dollar to an employee as a medical benefit, you don't pay Social Security tax, you don't pay Medicare tax. It's not considered wages for workman's comp purposes. So there are a lot of unemployment purposes. So there's about another 10% of costs that when you pay an employee that accompany that. Well, with a health reimbursement arrangement, giving that employee a dollar, they get the full dollar. The employer, there's no extra cost. So it's a great program, and it's available to not only it gets a little tricky for self-employed people, but we have some techniques to use it. So for businesses, self-employed people, it's a great way to get benefits for yourself if you're the owner. It's also a great program to offer employees. One of the other things that I like about it is a lot of companies offer, health care for their employees, but they don't include the spouses, no children, things like that. The beauty of the health reimbursement arrangement is that, let's say you have an employee and their spouse works at Cherry Point or something, and they get health care benefits already through the spouse that works there. If you were to offer health insurance to your employees, that benefit would be no good to that employee who's already covered for health insurance on another plan. And so the beauty of the Section 105 plan is that that employee can still get the benefit. They can use that money to pay for out-of-pocket costs. They can use that money to pay for part of the premium that the employer may force you to pay. So what the Section 105 plan does is it levels the playing field, and it gives everyone the same benefit no matter where one's spouse is employed. So we really like it. The one drawback to it is that it is not health insurance. And so if an employee or person is not healthy enough to get an individual policy, this will not help them, because unlike group medical insurance is required to cover everyone, this is not insurance. The employee has to go out and get their own policy. What's interesting about it is we look at this all the time. Many times individuals going out and getting their own policy is cheaper than a small company setting up a group policy. If you have a small company and you have one person that has some sort of chronic illness, or even the insurers treat pregnancy at a higher rate, the entire group ends up paying for that. And so when you go out and get an individual policy, you're effectively buying insurance in the group of all the individuals in the state. For example, Blue Cross Blue Shield, they have a couple of plans for individuals, and so your group is effectively all the individuals in the state who are buying insurance. And a lot of times you'll see that it's actually cheaper to purchase that way rather than being in a small group where there may be some health issues. But once again, the Section 105 Health Reimbursement Plan, it cannot help a person that cannot get insurance. For that, you need a group, some type of group plan. Well, that brings us to our first break. When we come back after the break, we'll continue discussing a little bit about health insurance and some alternatives in the marketplace. For All Things Money, I'm David Blain.